The following is a recorded program of an actual stroke support group. The comments expressed are the personal opinions of the participants and not necessarily the opinions of the producers, sponsors, or the broadcasters of this show. This program is not to be used as a way to diagnose or treat any medical condition that you may have. Please consult your doctor or healthcare professional before making any changes to your current medical routine.
Stroke.
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 It comes out of the blue, sometimes without warning.
But those who survive it
should never lose hope.
A stroke can be life-changing.
But it is also
a new beginning.
Because for all survivors, there is still a beautiful life after stroke.
Hey everybody, this is Life After Stroke. I'm Christopher Ewing. Thank you so much for tuning in. Today we are broadcasting from two places. First off, we're going to start here at Cedars Sinai Medical Center, and then by the magic of radio, we're going to transport all the way back over to home base, which is Providence St. Joseph's Medical Center in Burbank. So first off, right now we are at Cedars Sinai Medical Center, and we are with Dr. Echo Tan. She is the Assistant Professor of Neurology here at Cedars Sinai Medical Center. And full disclosure, she is one of my doctors. How are you?
I'm doing well, thank you.
Good to see you. See, now I've kind of come into your domain and put you in my domain now, so now
Yes.
I get to pick and prod at you a little bit. But first off, we're really at kind of a hallowed ground for me. Cedars Sinai Medical Center, I basically owe my life to. As many of you know who listened to the show, on April 21st of 2018, I had a hemorrhagic stroke and was sent here and basically was rescued from the jaws of death. I mean, I was really kind of a mess, and I really owe them my life here at Cedars, and now Dr. Tan has a little bit of the leftovers, and she is responsible for helping me kind of get my mobility back going again in terms of the topic that we're going to discuss, which is Botox. And Dr. Tan, I think first off, why don't you introduce yourself to everybody who's listening and kind of brag it a little bit and tell them about your background, and then we'll get into our topic.
Sure. So I've been a neurologist here at Cedars Sinai for about 4 to 5 years. I'm a specialist in what we call movement disorders. So I specialize in things like Parkinson's disease, essential tremor, dystonia, and spasticity. And one of my specialties in that area is to inject Botox and other types of toxins for dystonia and spasticity. And so that's what brought you to me.
Mm-hmm. Yeah, one of my doctors here kind of evaluated me after rehabilitation. Was like, you'd be a good candidate for Botox because I happen to be one of those who suffer from spasticity. And, I guess kind of first off, many of the people listening may be somewhat familiar with spasticity, but since, you're here and you are the professional who can speak very learned on it, kind of bring us up to date as to what the heck is spasticity and where, what, why, and how.
Be happy to. So spasticity is a term that we use to describe contractions and spasms of muscle that happen after a person has had damage to the brain. So whether that be from a stroke or a traumatic brain injury or from a tumor being removed or an aneurysm, the muscles in an arm or leg or both may contract and be kind of stuck in a certain way where you're not able to have a full range of motion or be able to use them as much as you would have before. And so there are medications and also things like Botox that we can use to help loosen those muscles, that you can get some of that range of motion back and get some of the functions of your life back.
Mm-hmm. Now, when it comes to stroke survivors and things like that, is spasticity something that's going to come and visit us all, or is it kind of rare or somewhere in between?
It is pretty common in stroke patients to varying degrees in each person, of course, and it can happen very quickly after you've had the stroke, or it may take years to develop.
Years, wow.
Yes. So everyone's a little bit differently, but more often than not, you will have a degree of spasticity because that's what the brain's natural instinct is to do after an injury.
And that when you say that that's what its natural thing to do is to kind of draw in or...
Yes, exactly. So the hand will draw in, the fingers will clench, the elbow will kind of draw up, the arm will come up, the shoulder will go in, and then the foot likes to point downwards.
Now, if spasticity hasn't presented itself shortly thereafter the initial stroke happens, are you kind of out of the woods? Like if you've been maybe 4 months, 5 months, 6 months, a year without it, can you pretty much kind of breathe a little easy that it's not going to happen?
I would say if you have gone a year, maybe even two after the stroke and you don't have much spasticity or any, then you're probably pretty out of the woods at that point. Usually what happens is in the first 6 months to a year after you've had your stroke and are on the road to recovery is when that spasticity comes back. And that's actually a sign of recovery.
Really?
Yes.
Explain why that is. How is that?
So in the beginning, the after you've had a stroke, after the cells and neurons are not there in the brain anymore, then the brain just kind of is trying to kind of slowly heal from that. And so they don't really know what to do with the arm. So the arm may just lie there in bed and being unable to move, being unable to hold any position. But over time, as things heal down, filling brain cells kind of grow back in, the blood resolves, the inflammation goes away, the natural instinct of the brain is to then kind of try to bring the arm back to a certain position, and that position is that closed hand, closed elbow, closed shoulder kind of position that is natural for the brain to do. And so that is a sign that the brain is actually recovering, and that that is when rehabilitation, physical therapy, occupational therapy are most important.
Now, are there any particular, or is there any particular type of stroke, whether it's ischemic or hemorrhagic, and or is there any particular area in the brain where the injury may happen that lends itself to someone being more likely to develop spasticity?
Any injury to any part of the brain can result in spasticity. We've seen injury from every single place you can possibly imagine in the brain develop into problems with spasticity. And so usually these areas are areas in the brain that help control your arm, control your leg. So if it was in the vision portion of your brain, then you probably won't experience any spasticity. You just would experience the vision problems because it's only affecting the vision part of your brain. Wow, so interesting. We're going to take a quick break, and when we come back, Dr. Tan is going to kind of walk us through some of the things that she does and some of the things that her team does in terms of helping people kind of get past this problem of spasticity, and also some of the things that maybe some of you who are listening may be able to inquire about with your doctors if you think that you may be experiencing something like spasticity. So sit tight, and we'll be right back. Hey everybody, welcome back to Life After Stroke. I'm Christopher Ewing, and today we're actually coming from two individual places. The first half of the show we're going to be coming from where we're at right now, which is Cedars Sinai Medical Center here in Los Angeles, and then by the magic of radio we're going to pop up over at home base back at Providence St. Joseph's Medical Center in Burbank. But first off, we're talking with, actually, full disclosure, one of my doctors, who is Dr. Echo Tan. She is the Assistant Professor of Neurology here at Cedars Sinai Medical Center, and she specializes in a really long phrase and stuff that I can't explain, but it has to do with botox, and it has to do with helping stroke survivors, people with Parkinson's and things like that, be able to get kind of additional functioning out of their limbs, arms and legs and things like that. Is that kind of the lay way to be able to describe it? That's a very good way of describing it. We call them botulinum toxin injections. So botox one of them.
And as you know, as is always the case, if you're listening all the time, you hear me say that there's so many questions that come up during commercial breaks. And so there's just a whole bunch of questions that I had that I figured, you know what, might as well just record some of these questions because I'm sure that many of you may have some of the same questions, and my mom is here and she had some questions. And so at any rate, figured, well, let's just go back on the air and just ask some of these questions just in case some of these questions are some of the same ones that you listeners have. So kind of one of the first things that I had wondered was, does spasticity only affect limbs like arms and legs and things like that? Because sometimes I notice that I'll get sometimes like a tightness in my tongue or my face that kind of feels like the same kind of spastic tightness that I'll get. Have you heard of anything like that before? Or is that just me being weird?
No, you're not being weird. Tightness in the tongue, or feeling like your speech is slurring more all of a sudden, or your face is doing something weird. Those are all things that can happen after you've had a stroke on the side that you're affected by. And what's interesting is, although in a way it kind of is like spasticity, it is kind of the same mechanism as spasticity, we don't call it spasticity. So we call that, stroke symptoms. We may call that dystonia, or if your face kind of twitches funny or your tongue does a funny thing, we may call that a dystonia. But no, we don't call it a spasticity. The word spasticity is reserved for the arm and the leg for some reason.
Yeah. And with me, it's not so much, thank goodness I don't have like a twitch or anything like that, but it's kind of the same thing that I experience with my arm and my leg sometimes, where if I get a little tired or fatigued, or if I'm trying to really push through something, obviously I do a lot of voiceovers and stuff, like voiceovers and things like that. Like just now, like sometimes if I'm trying to talk rather quickly, I can't kind of get things out of the way and make things just kind of happen like I used to. But it's kind of, and for those of you who are listening who do experience spasticity, you'll know what I mean. It's almost kind of like, especially with your arms and legs, you're kind of fighting with yourself. It's like, if you want to reach for something really quickly or something, your body will say, well, now wait, let's not move so quickly here. Let's just kind of look at this. And it's like, if you could just relax, I could just do this,
Exactly.
That drives me crazy. Why in the world does that happen?
That's a very good question. That's what the brain is trying to do. And that's what we're trying to do with things like Botox, is release those muscles that are just trying too hard to close your hand, so that, if we release those muscles, your hand can open, and then at least you can hold on to your bottle of water or your toothbrush or your spoon.
Because I think it's funny you say bottle of water, because I think I said to you, I've kicked more bottles of water across the room because I'll have it in my hand and I'll go to walk, but my brain is now just trying to figure out how to do two things at once like it used to. So walking and carrying a bottle of water was a big challenge in the beginning, and it's kind of is a little bit now, but I mean, I've walked like 2 steps and all of a sudden I've dropped the bottle and my foot is kicking that bottle all the way across the room because it just wouldn't hold it while I was concentrating on just trying to learn to walk again. So
exactly.
Let's just dive right into this Botox thing. So first off, when was it discovered that Botox actually had a function in this world?
So when Botox was first discovered and commercially used for medical purposes, it was actually called oculinum because it was used for eye muscles for people who had strabismus, or a problem where one eye would kind of look off to one side, what we call lazy eye. And so this was 1977. And then after a while, they rebranded it as Botox for the company Allergan, I think in 1989. And from then on, it was used for a bunch of different things. They kept discovering new ways to use it. So it's the same thing we use for wrinkles, for cosmetics. We use it for spasticity. We use it for the eye problems. We use it for dystonia or neck spasms. We use it for overactive bladder. We use it for excessive sweating, or what we call hyperhidrosis. and a bunch of other spasms in different places of the body as well. And then they've created it to use for migraines as well.
There's
And
so many
now,
applications for botox.
exactly. And now they're also looking into using it for drooling too.
Really?
Yeah, excessive drooling.
My goodness. It's so funny because obviously we all know and some know it and love it for cosmetic purposes and stuff like that. But it's just amazing to hear all the different
There are
ways that it's
so
used
many
and things
different
like that.
ways to use it now.
And so when did it really find its way being used predominantly
For-
or significantly in the stroke world? Was that early on? Or?
No, it was much later on in 2010 is when it was FDA approved for use in what we call upper limb spasticity, so arm spasticity. And just in the past couple years has it been approved for use for lower limb spasticity or leg spasticity. And so now we actually have 3 toxins, not just Botox, but we have Xeomin, Dysport, and Myoblock as well. And so the first 3 that I mentioned are all used for spasticity now.
Now, when you say that it was originally approved for upper limbs and then it took a while for it to be approved for the lower limbs, was there a reason why they didn't just say, yeah, it's good to go with both at the same time?
Well, when you have something that it needs FDA approval, what you need to do is design a study to prove that it works and doesn't have the side effects and risks that make it basically not worth it to use. And so I think they designed the study to concentrate on upper limb because the upper limb is a little bit easier to do and see the effects of. The lower limb is a little bit more difficult to do, and you need more usually toxin to do the lower limb.
I
So
see.
that's why I think that's probably why they approved the arm first.
Now, before there was Botox and things like this used for this purpose, what did people do then? What did people do, in terms of spasticity? Was that when they had like the drugs, like the muscle relaxers, stuff like baclofen and all that stuff?
Yes, so baclofen is one drug. There's also other muscle relaxants that they use, but yes, that was the primary thing that we tried. It's still used today. It's still very effective today. So we often use both together. And then other things that they would do is they would inject alcohol into the nerves and to basically kill the nerves or deaden the nerves so that the muscle would relax. And they also went in and did surgery and basically removed the nerves, or what we call rhizotomy, to help those muscles relax.
And now all of this tension in these muscles is all stemming from some crazy place in our brain that just won't chill out? Is that basically what's the root of this problem?
That's basically, so when the brain is essentially off, that off state is to kind of clench certain muscles.
And so the whole purpose of this Botox especially is to kind of go to that area that is being overcharged by the brain and just cause it to chill out. So the brain can just keep wanting to send all kinds of hyperspastic signals to it. But by deadening that nerve and that muscle there, it's just only going to half hear it. Is that kind of...
If you want to explain it in terms of, think about it as a light bulb and a control box. So the control box is your brain and the light bulb is your muscle. And that light bulb is on and it's on all the time. And it's just burning too bright, so to speak. So the Botox actually works on the wire or inside the light bulb and just kind of snips those wires
almost
in
like
there.
a dimmer, huh?
It's like a dimmer. So to kind of release that brightness. It doesn't work on the control box. It only
Sure.
works on the light bulb end of things.
Gotcha. So, okay, so walk us through a little bit. So, somebody listening is a stroke survivor. They've got spasticity in their arm or their leg, and it's like, okay, it's like getting on their nerves, and it's just tense all the time. The doctor says, oh, you know what, go see Dr. Tan. Walk us through. How do you go about trying to help us?
So what we usually have you do is come in for what we call a consultation, and then we look at your arm, we look at your leg, we see what kind of range of motion you have in your shoulder, in your elbow, in your fingers, in your thumb, in your knee, in your ankle. We see what kind of braces you need if you walk with an a foot brace, if you need a hand brace, if you need a shoulder support. And then we ask you about your daily life, how much help you need with certain things during your day, getting dressed, washing your hands, putting on your shirt, eating, etc. And then ask how much can you do on your own in terms of being able to move your arm on your own without having someone able to help you. And then based on all those many factors, we decide, what areas to concentrate on. We often need to pick areas to concentrate on. We can't usually do everything. And then decide what your goals are going to be, because a lot of the times, the majority of our conversation during that hour is about what is accomplishable and what can be done and what can't be done. Because the last thing I want to do is inject you and do things to you and then you be disappointed in the result because you were thinking that you were going to have something else.
Right. Now, obviously, I've been through the procedure a couple of times, but for those who haven't, I'll kind of ask as if they're asking, how long does the actual procedure take?
The procedure itself is pretty short, usually about 15, 20 minutes maximum. The first time may be a little bit longer while we're kind of figuring out how to position you and how to inject you and where your muscles are in particular, because everyone is just a tiny bit different. And then after that, it can be as quick as 5 minutes. It can still take 20 minutes, depending on how many muscles and how many injections you have.
Now, if I remember correctly, there's something that you hook me up to, and then there's a computer that you seem to look at and refer to. What is that?
So that is an EMG machine. It senses muscle activity. So what we do is we put 2 sticker electrodes onto your skin, relatively close to where we're going to be injecting. And then the needle has the syringe on it with the fluid that has the botox in it, but it also has another wire that goes back to the machine that picks up the muscle activity. So as the needle is in the muscle, I can tell it's in the muscle because the machine will make a certain noise when it's in the muscle. And if you can, I ask you to move your arm while the needle is in there so that the sound becomes louder.
I see. And one thing I remember when you and I first met several months ago, one of the cool things that I was really impressed with was that you watched me walk and you kind of got an idea as to, okay, I see what's happening here. And you kind of, I guess at that point, were able to really assess where you needed to dive into and what you needed to hit.
Exactly. So everyone's walk is a little bit different. Different muscle groups are going to be stronger than others. Sometimes you have both, for example, the front of the leg be strong and the back of the leg be too strong. So when that's the case, you kind of have to think about how to rebalance the leg.
Yeah, see, that's what I mean. So it's not like, oh, okay, come on for Botox and then we just hit this and hit this. You really kind of look and see which side of the leg, the front or the back, or that whole thing to really know which one you're going to hit. Every
single patient is different. I don't have 2 patients who have the same injection kind of pattern.
Sure. And then once you go through the procedure and it's like, okay, you're good to go home now, how soon can someone expect to see some benefit to the Botox?
We typically tell our patients that you can start to see benefit anywhere from as soon as 2 days to 2 weeks. Usually the peak effect being about 4 weeks out. And sometimes we have you come back in about that 5 week mark so we can see what changes we have made, what improvements you have made, and have you give us a little bit of feedback, or maybe even have the physical therapist give us a little bit of feedback in terms of what they can do now during their therapy sessions. And then from there, we can kind of tailor it for the next time. And then these injections should last about 2 to 3, hopefully at least 3 months, because then we'll inject again in about 3 months.
I see. Gotcha. Now, on that topic, that is one thing I remember you telling me is that when you put in Botox, you don't want to put in too much because you do want there to be some spasticity to a degree. Explain a little bit about that.
So, for example, a hand, you have muscles that close the hand and then you have muscles that open the hand, and they kind of work against each other. and with each other at the same time. And so usually the ones that close of the hand are too tight. Now, if you loosen those, you're loosening the muscles that tighten your hand. So the same muscles you need to grab your water, to grab your spoon, to hold your toothbrush, to hold your purse. So I can't loosen those muscles too much. I can only loosen those muscles to a certain extent.
Otherwise, you won't be able to hold anything.
Exactly, or you won't be able to hold things, and then your hand will just be really loose and almost floppy at your side.
Boy, so what a skill it takes on your part to really kind of put in the right amount.
Yes, it's definitely the right amount, and that depends person to person, how bad the spasticity is, whether you're 5 foot or you're 6'2". That all changes
so
the
much, so many
situation.
factors that have to go in. That's just amazing. And I guess that's why you had said that people come in for not just an evaluation, but then a few weeks after you administer the Botox, they come back again and you kind of evaluate to see, did we put in enough? Do we put in too much? Do we need to put in more? I mean, you really kind of won't know that until you kind of get in there, huh?
Exactly. So we after doing this for a while, you kind of get a good sense of roughly how much you need. But then again, it's person dependent and task dependent. So when you come back, it's really a lot of feedback on what you think, what you see, and then what we're going to achieve from then on out.
Right. Can someone expect there to be a point in time where maybe they won't have to get Botox injections anymore? Or
I think that really is patient dependent. There are a few patients where they have found that over the years they've had to come back for injections less frequently because they've been able to then maximize their therapy so that they can regain that range of motion that they wanted. But because this is a natural instinct of the brain to clench those muscles, we're not changing the brain necessarily. So there will always be a degree of spasticity there. And not all spasticity is bad. Some of it is good and some of it is necessary.
Right. Now, would working with your PT and OT help in the long run in terms of how much Botox you might need going forward in the future? Can working through and working with your PT and OT strengthen and rewire your brain? Would doing that allow you to help not need Botox going forward?
Yes, it can. So by having PT, OT, using hand braces to kind of open that hand or open those muscles up, in the long run, I can inject less. We can inject less often to achieve the same goals.
So I guess
times.
And not to interrupt, I guess what I was thinking is that somebody shouldn't get Botox and just sit back and be like, okay, I'll just let the Botox kick in and everything else, but really
Definitely
continue
not.
to work with your physical therapist and occupational therapist.
Yes, the therapy portion, the stretching portion, your own portion that you do at home is actually probably more important than the toxin itself.
Gotcha. Is there a point to where maybe it's too late to think about getting any kind of Botox therapy? Like, okay, I'm like 4 years, 5 years into this stroke thing, and it's not going to do me any good?
Sometimes there are patients who come to me too late, and it's not a matter of time. I've had patients come to me at the 4-year, 5-year mark, and they're still candidates for Botox injections, and we do them. And there are some people who come to me 2 years after their stroke, and they're not a candidate because what happens is those muscles are so tight for so long that they shorten to that length. And so when they shorten and that muscle kind of not dies, but changes and becomes more fatty tissue or becomes more fiber tissue and becomes more like tendon tissue, then the Botox won't be able to work on stuff that's not muscle. So in those cases, when that muscle is shortened or those has become more tendinous, then we may have to send them to an orthopedic surgeon to see about having those tendons lengthened or to have surgery to have it corrected.
how long does it take post-stroke for things like that to start to shorten or change to the point of almost no return type of thing, or surgery?
I would say years, at least for most patients who have some sort of at least self-care or someone who can help them at least try to maintain flexibility, open their hand on a daily basis, open their elbow. It shouldn't happen quickly. It shouldn't happen quickly at all. For those people who maybe their stroke was so devastating or so bad that they're in bed all the time, they can't move at all. Unfortunately, in those kinds of situations, then that muscle change will happen faster.
What are some of the kind of cool things that you've seen happen with some of your patients after getting Botox and things like that? Have you seen some really great success?
Yes, I've had a lot of patients come back really happy with their results. I've had a few patients who were finally able to walk. They used to be able to just kind of stand there because one leg wouldn't reach the ground.
Wow.
And so now they were able to put their foot on the ground and with the knee brace kind of take a few steps with the walker. Have patients been able to start to open their hand again and open their hand enough that they can either grab something like their spoon or a cup or even open their hand enough so that they can wash their hand, because that sometimes is an issue.
Really? Wow, it just gets so closed, huh?
Yeah, it gets so closed that their nails dig into their hand. They can't cut their nails. They can't wash their hand. And so that, I think, a lot of time is a really, really big issue.
Wow, yeah. Wow. Is there any case where Botox is not recommended or wouldn't be beneficial for someone or wouldn't be suggested or even prescribed?
There are very few cases where Botox wouldn't be a good idea. In most cases, in people who I've had the discussion with that maybe they're not the best candidate, are those who actually have really good range of motion and they have very, very little spasticity. And so when they come to me, they come for a consultation, but number one, they have very little spasticity. Number two, they have very good range of motion. And then number three is what they're wanting from the Botox is not possible. And so when they're looking for something that I cannot give them, then we have to have a good conversation about either modifying their expectations or maybe saying that Botox is not for them.
Is that because they're thinking that Botox might help them move better or run faster when really it's not a spasticity problem to begin with?
Exactly. So they're looking to walk like a normal person again without a cane, without a brace, or they're looking to play tennis again with their arm or play piano again or something that requires that's more muscle control.
So that's more physical therapy.
Yeah, more PT, more than just releasing muscle spasms.
You had mentioned that there's 3 different types of these toxins now. Is there one that's better than the other? I mean, why do they have different types now?
Well, everybody wants to get in on the market, wants to get their share of the pie. So they're different. They pretty much act on the same place within the nerve muscle connection. But they haven't done any studies to compare the 3 head to head. So we don't know whether one is better than the other. Each one has their own kind of advantages and disadvantages. Each one has a contract with different insurances, so that may change the game as well. So, but we use all of them. Gotcha. Just depending.
And that kind of leads me into my next question: is Botox something that insurance companies cover?
Yes. So it does cover it for spasticity, for upper limb, for lower limb. Medicare covers it. Private insurance companies cover it as well. Your doctor just needs to know how to file the claim, and then most toxin companies, so Allergan, Mertz, which is the other company, Dysport, these companies usually have patient assistance programs or savings programs, so that if you do have a copay or a deductible, they will help you out with those costs depending on your other bills and things per year.
Gotcha. Now, we've got listeners all over the world. Are there Botox doctors or Botox centers? Are there strokes? How do you go about finding a doctor who knows how to administer Botox?
Usually your stroke doctor has a doctor that they will refer you to, or they may do it themselves. So people doctors who usually inject this are going to be neurologists. They may or may not be movement disorder specialists. I have colleagues who aren't movement disorder specialists, and they also inject this for spasticity. Or you may go to what we call physiatrist, which is a specialist in physical medicine and rehabilitation. And so those doctors are also trained in treating spasticity.
I see. Boy, this is all so fascinating. So Mom had a question, which was, why is spasticity stronger and more prominent in the morning?
That is a very good question. It's not the same mechanism, but if you think about it like your joints in the morning or arthritis in the morning, everything's just kind of slower to kind of get going in the morning. You wake up, you're not as clear in the morning. Everything just kind of takes a minute to get going. The same way your brain needs a moment to wake up. All those circuits that your brain turns on to tell your muscles to relax need a moment to kind of power up to full speed. And so that's one of the reasons why many people have more stiffness in the morning.
Gotcha.
And then some people actually have more stiffness at night because at the end of the day, they're tired, they've used their muscles all day. And so that's also another time of day when people are more stiff.
So that spasticity will kick in and try to...
Yes, it kicks in more.
Yeah.
Your body is done. I'm tired.
Gotcha.
It's time to go to sleep and rest.
Gotcha. Does spasticity have its genesis somewhere in relation to nerve damage? Or is spasticity something else? It's like, because I notice that water droplets hitting my arm will drive me crazy sometimes. Like very, hypersensitivity. Is that part of spasticity, or is that more nerve? Or are they connected?
The hypersensitivity is different from spasticity.
I see. So spasticity and nerve damage of sorts is not really connected.
Nerve damage is related to spasticity, but there are two. If you want to split up nerves into two types, there's motor nerves or nerves to move, and there's nerves to sense or sensory nerves.
Here we go.
So the hypersensitivity is from the sensory nerves not
the
working.
Motor.
Yes, and the spasticity is from the motor nerves not working.
I see. So say that again. There's two different types
of nerves. There's motor nerves, which we need to move, and then sensory nerves, which we need to sense.
To
sense
feel.
Heat, pain, position, just anything.
Got it.
Sense a needle. So depending on where your stroke was, it may damage both. And so you may have both types of problems. Numbness, tingling, burning, hypersensitivity, and the spasticity part.
Welcome to my world. Absolutely. This is all so fascinating. Final thoughts.
Spasticity is not always a bad thing. But when it becomes a bad thing or when there's too much of it, we definitely have ways of releasing it. And if you have any thought that Botox or one of the toxins may be helpful to you, it's never too early and never too late to go and see someone about it.
Well, Doctor, this has just been so awesome. We've been speaking with Dr. Echo Tan. She is the Assistant Professor of Neurology here at Cedars Sinai Medical Center. And Doc, it is just so cool to see you just, without having to come here and getting poked and prodded, but just to be able to really share you with the listeners because you've explained this stuff to me so well many times before, being your patient, of course. I'm just so glad that you've been able to take the time to share the same information with all the listeners. So thank you very, very much.
Thank you for having me. It's been a pleasure to share this with your entire audience.
Thanks. We're going to take a break, and when we come back, by the magic of radio, we are going to be at home base back at Providence St. Joseph's Medical Center during our support group. So sit tight and hang out, and we'll be right back. Hey, this is Christopher Ewing with a Life After Stroke health tip. So if you're a stroke survivor, then I'm sure you know the exact date that you had your stroke, maybe even right down to the exact hour and minute. We're often asked by doctors, therapists, and even loved ones, so when did you have your stroke? So that makes the date kind of hard to forget. But do you know the date when you started to show signs of recovery? Like when you were first able to move your leg again or your arm? The times when your brain and body start to show signs of improvement following a stroke are even more important than the day you had your stroke, because these are the times when your body is showing you signs that it is actually healing. And it is also a sign that all of your hard work and therapy is paying off. And those times should be celebrated. I call these moments milestones, and one thing I do that I'd like for you to do is to have a milestone journal where you keep track of all the breakthroughs that happen along your journey towards recovery. For instance, in my milestone journal, while it says April 21st, 2018 is when I had my stroke, I can see that it was May 4th, 2018 when my ankle first started to move again, May 9th when I could close my fingers for the first time, May 23rd when I was able to take a few steps on my own unassisted as I was learning to walk again, and so on. It's very easy for us to remember the one terrible day that we had our stroke, but what about all of the awesome days when we noticed signs that we were actually healing and getting better? So here's what I'd like you to do. Just get a notebook, or I happen to use the Notes app on my phone, and whenever you make a special accomplishment in your recovery, just jot it down, making note of the date, the time, where you were, who was with you, and anything else you want to make note of about that special moment. It's really cool to every now and then just look back and read about some of the breakthroughs or the milestones that you have reached on your road towards recovery from your stroke. We can spend time being bummed about the loss of ability, or we can spend time celebrating the recovery of those abilities as they happen. I say, let's celebrate our recovery and all of the milestones along the way. And if you have a recovery milestone, write us and tell us about it. Just send me an email to mail@thestrokechannel.tv. That's mail@thestrokechannel.tv. And congratulations on your milestones. I'm Christopher Ewing, and this has been a Life After Stroke health tip. Hey everybody, this is Christopher Ewing, and you just heard a really informative interview on spasticity with Dr. Tan at Cedars Sinai Medical Center in Los Angeles. And the next segment was taped a few days earlier at our home base location, which is Providence St. Joseph's Medical Center in Burbank, where we hold our weekly stroke support group. Now, you've heard me talk recently about the importance of celebrating milestones and breakthroughs that we experience during our recovery from stroke, and in this next segment, you're actually going to witness one. During our taping, a volunteer at the hospital who does animal therapy, where she takes her dog into patients' rooms and allows them to visit with the dog, came into the room we tape in, and one of our stroke survivors who participates in our group sessions revealed that he has been afraid of dogs ever since he had his stroke 9 years ago. Prior to his stroke, he had 4 dogs and 3 cats. But following his stroke, something happened in his brain that had caused him to not even want to be near a dog at any time. And during some of our previous shows, we've heard other stroke survivors talk about just some of the mood changes and personality changes that they've experienced following their stroke for reasons that they can't explain. Well, this segment you are about to hear is one of those occasions where a stroke survivor experienced a moment where he confronted his frustration and fear and conquered it head on. This was a really emotional milestone breakthrough moment for everyone who was there. There wasn't a dry eye in the room, and the gentleman expressed afterward just how happy he was that he had had the chance to work through it. And this just shows just how important being a part of a stroke support group can really be. So check out this very emotional breakthrough moment that happened with one of our fellow stroke survivor friends during our stroke support group just a few days ago. Hey everybody, this is Life After Stroke. I'm Christopher Ewing. Thank you so much for tuning in. Today we're broadcasting from Providence St. Joseph's Medical Center in Burbank, California. And as you know, we taped the show during a stroke support group, and that's kind of what goes on here. We all kind of hang out and talk and stuff like that. Today we've got a couple of our stroke survivors here, one of which is an author who has written actually several books, and so we're going to talk to him. We will start over here first and say hi to Dave. Dave, what's going on, man?
Hello, my name's Dave. I had a massive right frontal stroke in 2016.
And your recovery has been remarkable, as we say every single episode.
It's getting there.
It is, man. It's so good. It's like it's beyond. It's really beyond it. And actually, Dave was saying last week that he was going to look into swimming
at the Y.
At the Y, and he did, and has come back with a glowing report.
Yeah.
So it looks like it's going to be good stuff.
Yep. Yeah. We're gonna do water polo.
Water polo. Oh,
Yeah.
Cool. Oh, so they do that too.
Sure, we can do anything.
Oh, gotcha.
They have open training days to where you can do anything you want.
Right. And everybody listening, I think that's really a cool thing. So like if your insurance is kind of stopped in terms of OT and PT and all of that, look into the Y. I mean, there's so many really good resources out there, you know?
Burbank Parks and Recs is another great one.
Yeah. So, I mean, obviously if you're local, here in Burbank, they've got all kinds of great stuff, but really wherever you're at, I mean, I think you can look into any of the community centers, the
senior centers.
Yep. Senior centers, colleges, just all kinds of really great resources out there that can kind of fill in the gap if your insurance is stopped or something like that, or if you just need
want
more
extra help.
Sure, exactly.
Or you just want to do something. You just want to stay busy.
Yep. Yep. You and I were thinking the same thing. Just if you just want to have some extra stuff, if you got extra time and want to stay really involved on a daily basis, there's all kinds of stuff. So definitely, very cool. And the twins are good.
Twins are great.
Twins are great. Oh, that's so awesome.
Twins are great. Yeah, they're in school right now.
Yeah, there you go. Dave was talking a few episodes about how he walks the kids to and from school. They're 7 years old, 7-year-old twins.
7-year-old twins, yeah.
Yeah, a boy and a girl, and that's just so awesome. I'm sure they're just, and the other thing, and I don't know if you mentioned it while we were on the air or not, but one of the things that you had mentioned that I thought was just so cute, when you had your stroke, you were in the hospital, and you said the kids climbed up in your bed.
My son tried to climb up in bed with me.
Oh.
Yeah, he because we were very, I'd always take them places and things, and then all of a sudden I couldn't. So he'd come to the hospital and he'd crawl into bed with me.
Oh, bless his heart.
Yeah.
That's so awesome.
And he'd lay in bed with me.
Yeah.
And the nurses just went right along with it,
Sure.
And they'd come over and they'd cover him up,
Yeah. Oh, bless his heart.
And he just, absolutely loved it.
And that was, a couple of years ago?
Yeah.
Yeah. Well, I'm sure they're just thrilled to have
right
Dad
down
back
the hallway.
now. You're just down the hallway. Yeah,
down the hallway, yeah.
There you go. Well, see, look how far you've come.
Yeah. I've gotten to this side of the hallway.
You got this side of the hallway.
Yep.
Yeah, right. And you no longer have to walk the halls at night and not be worried that you're going to get busted.
I peeked my head out the door to see if anybody was in the hallway.
Yeah, right. See if we can catch you.
Yeah, I still get that feeling when I look around here.
Well, that's just awesome. Well, man, like I said, your recovery is just such a great example to all of us, and I'm just so thrilled that you're doing so well, and I'm sure your kids are just thrilled to have Dad back.
Yeah, the kids are.
Walk them to and from school and do all that fun stuff.
This morning was umbrellas. Everybody had umbrellas, so they turned into swords.
Yeah.
And then, as soon as there was a puddle, it's the first thing you got to do is jump in the puddle.
Yeah.
So they're having a great time.
Well, that's so awesome. So awesome. And across
How long were you kept in the hospital?
I was here for about 70 days.
70 days. Wow.
Really? Wow. That's a long time.
Yeah.
It is a long time.
Well, I had a massive right frontal.
Now, was a lot of that time spent here in the rehabilitation part of the hospital?
Some of it was in a rehab, but my rehab didn't seem to take very long. I mean, I shouldn't say it. It took a long time because I had to learn how to swallow again.
Yes, right.
And it was still a problem for a long time. I couldn't drink water. It would just wash down my throat.
Wow.
And I'd end up choking.
Right.
So I had to learn all that all over again. And walking, I had 2 nurses that would come to my room every day with my shoes saying, "Is today the day?" And they would, get me up and walk me. And one is still here, Irene, and she would just do it every day. And then they walk me in the back of the hospital out. Behind the hospital, there's a stairway, and I'd go up and down the stairs, learning how to go up and down.
Wow.
And up the stairs, down the stairs, up the stairs, down the stairs, until I was exhausted, and then they would bring me back.
You know, and I say it all the time. Not enough can be said about the physical therapists and the occupational therapists and the speech therapists that catch us, you know, right immediately post-stroke and get us on our feet, get us talking again and moving again. I mean, they are just so precious, vital, a godsend, a blessing, anything else you want to call them. You know what I mean?
Yeah, they actually catch us at our absolute lowest point.
Absolutely, and get us going. And I mean,
turn us around.
Yeah, it's like we're stranded on the side of the highway with flat tires and out of gas and everything else, and they come and get us rolling again. You know?
Yeah.
I mean. They are just, I mean, really at that most important point.
Yeah, it's like we're on that bridge, you know, about ready to be pushed over, and they're grabbing us.
Absolutely. Absolutely.
They actually, so very grateful.
Oh, absolutely. Because, really, when you stop and think about it, I mean, we're kind of like, okay, what the heck just happened here, you know? And nothing's working. Everything's offline. We're just like devastated, literally, from top to bottom.
Yeah, especially you can barely talk.
Absolutely. Absolutely.
You're still biting your cheeks.
Yes. Oh, Dave, when you mentioned that the other day when we were at lunch and you were telling me about that, oh my gosh. I mean, not to sound gross, I know that I have swallowed more parts of my inner face, you know? I mean, I've bitten into more hamburgers and and really the worst part about it is because your face is so numb, you realize, first of all, you don't realize that you did it until you realize your teeth did not close all the way. And then you immediately think, oh, I bet that hurt. You know?
Yeah, that's for sure.
You know, I bet that's going to leave a mark, you know, because you didn't feel how bad it hurt, but you knew it probably hurt.
Yeah, or how big was that piece?
Yeah, how big, exactly. I mean, oh my gosh. And when I would do it, people would look at me like my mom and stuff like that. They'd see me make this big flinch, like, oh, and I'm holding my face. But it really didn't hurt as much as I knew it probably should have hurt.
Yeah.
But, you're so numb that you just don't realize it. So I thought it was only me. But then when I heard you were chewing your face off, then I was like, oh, poor guy. You know?
Yeah, well, there's a lot of things like that, though.
Yes.
Only having the stroke, you realize that stuff.
Yeah.
And things you just don't realize that other people go through.
Sure.
And all of a sudden, you become aware of it.
Yes.
Absolutely.
And it's like what you're doing now to make people aware of it is wonderful.
Well, I think what we're all doing here is definitely adding something. We get emails from everybody and stuff like that. And
yeah, but you're still the apex. I mean, you take the credit. I mean, really, you've done a remarkable thing.
Well, like I said, man,
or you're doing a remarkable thing.
Thanks. I mean,
yes.
Really all I'm doing, I was laying in the hospital thinking about the fact that I, work in television and radio, and I've got all this equipment that I might as well put it to use, somehow. And so that's the only reason I do this. But I got to tell you, without your stories, I appreciate what you're saying, Dave, and it's very kind of you. But, I think I'm just doing what I think we all should do, and that's why we're here, is just, we're all in this together. We're one big family.
Well, I agree. And my wife, just like my wife said, she wants to do it for like the survivors or the ones that are actually, in the
well, not exactly the background, but the foreground, but behind us. Absolutely, I got you.
One's behind us. Yeah.
I know what you mean. Well, I've got something up my sleeve for the caregivers that we're going to announce it in the next couple of weeks. I'm just kind of taking my time putting it all together, but it's for all you caregivers out there. Have I got something for you? So you just sit tight. We're coming for you. We got something for you, because don't think you've fallen through the radar here at all.
I got a treat for you guys. There's a therapy friend.
Come on in.
I told him that you were doing the stroke support group.
Oh, so we've got somebody. Like I said, this is part of a stroke support group here, and anything could happen. And the most cutest dog just rolled in here. Yeah, come on over here, ma'am, if you don't mind. Yeah, come on over here. Why don't you pull up?
No, dude.
Oh, you're scared of dogs.
Come close to me.
Okay, tell you what.
I love dogs prior to the stroke.
Okay.
Oh.
Wow, isn't that interesting?
Yeah.
So prior to the stroke, that dog like that wouldn't have bothered you at all. No. Isn't that something? You know what? Why don't you slide your chair over a little bit, or maybe you can. Just want to have you. Do you mind coming over and talking a little bit about what you do? Well, no. Can you come to the mic here?
Yeah.
Yeah. Okay.
I'll stay with Sherman.
Yeah. There you go.
I'll be between you.
Yeah. There you go.
Is that okay?
And maybe just spin that mic.
Okay.
You okay?
We'll be between you.
There you go, Bob.
Okay.
That's good. You're okay, right?
Yeah.
Okay. And ma'am, why don't you take the mic for a minute and tell us who you are and what you do? You can lift it up. It'll come up to you.
Hi, my name is Candy, and I have a therapy dog here at St. Joe's Hospital. She's been here over 7 years.
Wow.
And she works also at the Big Veterans on Wilshire.
Yeah, she's
does a
adorable.
number of
Now,
jobs
I'm probably
there.
going to call her breed. She looks like one of those King Charles.
King Charles
Oh, so I
Cavalier
guessed right.
Spaniel.
She's just a little darker than the ones that I've usually seen. But
She's
boy,
big.
she's beautiful.
She's a big girl.
She is beautiful. My goodness.
And she was a rescue.
Oh my goodness. Well, thank you. That's awesome for you.
Yeah.
Oh, what a
She's
face.
very well mannered and she's bilingual.
And she's bilingual. There you go.
Dame la patita.
Oh my goodness.
Que besen en alto.
Oh, is that I wish that's it. You know, I always say I'm putting this on video sooner than later. We just gotta go straight to video so we see this stuff. If you could keep the mic for a minute, I just want to ask you.
Sure.
So how long have you been doing kind of this type of
Therapy work?
Sure. If you could hold the
Sherman-
mic up closer to your mouth, because
Sherman Oaks and I
Uh-huh.
have been here at St. Joe's a little over 7 years.
Wow.
And we've been at the VA for almost 6.
Right.
It took a year to get in.
Wow.
So, almost 6 years. And she does hospital, rehab, and convalescent there. And here she does everything.
Isn't that something? Now, what made you want to do that? What?
Well, to be honest, I love my dog.
Mm-hmm.
She's perfect for the job. But I didn't realize they had this going on. My girlfriend has been here 20 years.
Uh-huh.
And so she got me into it. And now she has 3 Cavaliers.
Wow.
And she shows 2 of them. And I'm sorry she's not here today because they're really sweet together. They're like related almost. And they're cute. It's like a bundle of puppies.
Oh,
and
is that
people
cute?
respond to that.
And what have been some of the really neat breakthroughs and things that you've seen through doing this kind of therapy?
Well, you know, you never really know for sure how much a person appreciates it. A dog coming in and you know, visiting. But I love it when they tell you because then you know.
Sure.
And other than that, she's been called for, we live close to the hospital, so they will call Sherman, myself, Candy, and they will have me come over if they have somebody that's having trouble in their room, high blood pressure, or they're freaking out.
Sure.
That's the wrong word.
I understand what you mean, sure.
Having a hard time.
Yeah.
And Sherman comes in, and she's very, very mellow, and she'll get on the bed with their permission, and the doctor's permission, and they pet her, they stroke her, and it calms them.
Oh.
And I've seen it work.
Yes.
So that's why I stay with it.
Sure.
I've seen it. It's
Wow.
really, really a good thing.
Absolutely.
What if they can't talk to you? Not a bit.
It really doesn't matter because the only thing they need to do is touch. If they touch the dog, they feel her gentleness and they feel her hair is soft and silky, and it's something you just stroke and it calms you down.
What about if you're afraid of the dog?
Well, first of all, we would never want to push a dog on anybody. Anybody.
You can't talk, and you can't tell the woman that you don't like the dog.
Yeah, I think they would probably find a way to communicate it, though.
They have outside your room, they have a board, a little panel, and they have like, if you were, say you were, you were allergic to a dog.
No.
Or you just don't want
I
them.
allowed the dog until I had my stroke.
But they would have that posted.
Isn't that interesting? So
They would have it
you
posted,
liked dogs
Oh, yes.
before your stroke.
I like dogs. I had 4 dogs in my house.
So what do you think happened, stroke-wise, that has caused you to...
I really don't know.
Well, now let's all take a moment here. This is why we're here, Candy, and that's Sherman Oaks.
Yes,
that's
Miss
such a
Sherman Oaks,
Miss Sherman
yes.
Oaks. I'm sorry, Miss Sherman Oaks. I mean, no disrespect.
My husband named her.
That's all right. how about if we take a moment and see if we can't kind of work some of this through? You know, Bob? I mean, you said you had 4 dogs,
Yes.
you know?
I had a dog
I understand.
of my own.
So let me ask you this. Is it you're afraid of them now, or what actually is it? Candy, can you
Yes.
take the mic to him?
Hardly
Candy?
afraid of them now.
You're afraid of them now. Now,
I can't. I cannot stand. Well, I have a dog in my lap or scurrying around the foot of it.
and what do you feel when that happens?
I feel afraid.
Isn't that something? Now, for everybody listening, and we'll take a picture of this and put it online or something. You know, King Charles Spaniels are small dogs. I mean, she's a little
She's
bigger
the bigger
than
one,
yeah. So she's maybe what 20 pounds at the most, I think.
Cocker Spaniel.
Yeah. So you know what, Candy? I'm going to be quiet for a moment, and why don't you work your magic here? You know, with Dr. Parker. This is Dr. Parker.
Hi, Dr. Parker. I'm Candy.
You know, this is what it's about, Dr. Parker. This is what it's about, man. And you've written all these books. I know. So I'm gonna let you know what I'm gonna let Miss Sherman Oaks do her thing, and Candy her handler.
And the last thing we want to do is force her on you.
Yes.
I don't want to do that.
No.
But if she's here, look, she's sleeping, kind of. Right, she's very mellow. Would you like to just touch her hair right there? No?
No.
Okay.
Okay.
Okay, there, see? She's so sweet. She's a sweet dog. She's never...
Yes, she is sweet.
But she's closer to you than you've had another dog so far since your stroke, right?
Yes. No. My daughter has 2 dogs, and they are close to me, and I really have to watch out for them every minute.
But your daughter's dogs, before you had the stroke, were your daughter's dogs okay? Were you okay?
Yes. Before I had the stroke, they were okay. I had them on my lap. I had them next to me.
Well, so what do you think it is about the stroke that has made that change?
I really don't know. It baffles me.
It baffles you. You, the professor, and everything. It is just...
No!
You're so sellouts. You're the doctor.
This is good.
This is really good.
So that's a form of therapy for you. You could work on.
This is it's amazing. It's very interesting.
Yeah.
So so now let's look at Miss Sherman Oaks, and she's knocked out, completely asleep.
She's very mellow.
Yeah.
Very mellow.
Okay.
She's very mellow. I see.
Yeah. So now, seeing how mellow she is, does that give you any added comfort that she's not gonna do anything bad? I mean, do you think she's gonna bite you? Is that what the fear is? What is the fear?
Not bite me.
What is the fear?
Get too close to me.
Okay.
Put her arm, put her tongue up to my mouth.
I see. So it's more of a germ thing?
No.
Okay, so it's
The
not
hair?
Hadn't thought of a gym thing, no.
Okay.
Nothing like that.
So you don't think she's going to bite you? You're not afraid of that? And you don't, but you're afraid that she's going to get too close to your skin?
I guess. Maybe that's it. I don't know.
Or, I mean, could you touch her fur?
I don't know.
Well, she's here, Dr. Parker.
You want to try
Ooh,
here?
Dr. Parker, go, Dr. Parker.
You pull her to where you
Awesome, Dr.
Look
Parker.
at that.
Awesome.
Very good.
I got to take a
Good
picture
job.
of that. I got to take a picture of that. That is so awesome.
Right, hang on.
Oh, he's going to take, he wants a picture on his own phone.
I have one too if you want.
So this, and we were just talking about therapists. Now we got to add Candy, and this is, I tell you, some things you just can't plan this stuff.
Just bumped into her in the
You just can't plan this stuff. Do it again, Dr. Parker. There you go. Okay, so now I'm going to cry, okay? I've held it together long enough. You guys that listen to this show all the time, you know how I get.
Congratulations, sir.
Dr. Parker,
Congratulations.
can I tell you how happy I am for you right now? Let me paint the picture, everybody, so you guys know what's going on here, because I don't know how I'm going to edit this. I'm not even going to edit this. I'm just going to just let this be. We were just, Candy, before you walked in, we were just talking about physical therapists and occupational therapists and speech therapists and what an important role they play in our lives. And I left the door open because I figured it wasn't going to be that noisy. And, we're at a hospital, so when people listening, they know we're at a hospital. So if you hear the announcements over the air, it's not a big deal. And then I saw that you were in the doorway, and Yesenia's here. Everybody from the first episode knows Yesenia. She works with the doctors that are here, and she's just part of our little crew and just an awesome woman. And I saw you in the doorway, and it's a support group. So I just figured, okay, well, whoever you are, come on in, And then I saw you the dog, and it's like, oh, okay, well, let's put her on the air. What the heck? And as soon as you rolled up, as you know, people at home don't know this, but as soon as Candy and the dog is in kind of a not a stroller, like a shopping cart kind of thing, as soon as it rolled up close to Dr. Parker, like, you kind of freaked out a little bit. I mean,
He freaked out.
He freaked out like, hey, you can't just roll up on people like that with this dog. You don't know. And I could see where that would be a normal reaction for somebody that's afraid of dogs. And as Dr. Parker was just sharing, he has never been afraid of dogs until his stroke. And I've heard that before, that sometimes after a stroke, your emotions change. Like we had one of our support survivors on a few weeks ago who said that her mood has changed.
Maybe it triggers something.
Maybe it triggers something. It's a good point. Now, that's something you might know as a therapist.
Change. Absolutely, it's changed.
But what an interesting role you play, Candy, and Miss Sherman Oaks, because 15 minutes ago, we weren't going to see him petting no dog. You know what I mean? I mean, that was like, he was ready to throw all you guys out of here. I think Dr. Parker was ready to throw us all out of here.
I really do appreciate that.
Take the mic so everybody can hear you. Grab your mic over there, Candy. Yeah, sure. There you go.
I really do appreciate you saying that, because you visit people,
Yes.
and they may like it and whatever, but you never know for sure how much of an impact it's making.
That's when I was in the hospital and I couldn't talk to anyone.
Well, and I talk about milestones, and, this is a milestone for you right here, Dr. Parker, because you weren't petting a dog 15 minutes ago. I can tell you now, you're ready to throw us all out of here. The last thing you were going to do was reach over there and pet that dog like you did. And I just think that is so awesome that you did that. I mean, you got the courage, and this is what support groups are about, you guys. This is what I'm saying. And Candy, don't have me...
Thank you.
Okay, now.
Thank you very much.
No, thank you.
You make me feel good.
No, thank you.
And I'm so happy for you.
I mean, look what you did for my friend over here. You know what I mean?
It really makes me happy.
I mean, he was not touching a dog. He was, and, this breakthrough on his part in his life would not have happened without you, Candy.
I really appreciate it, because the veterans, they have nothing. They have nothing. And Sherman and I go, and they're so sweet and so kind. And I copied, my husband was in Vietnam, and they wore boonie hats, what they call boonie hats. I copied his and made her one. So the guys put their unit pins on her hat, and they look forward to seeing her, a lot of them. Maybe not everyone, but those that do, it gives them something to look forward to.
Right.
And it's it's nice. It's nice for me to know that.
Well, what a difference you are making in people's
I
lives.
love them.
You know, and just like, it's so weird too. I asked you, have you ever seen any, like, you know, what kind of breakthroughs have you seen? Okay, well, here, we just had one, didn't we? Am I right? I think we just had
a
one.
little one, but
I don't know. This is a little bigger than a little one. 'Cause
That was pretty good.
15 minutes ago, you were not having any part of Candy, that dog. I'm like, oh, shoot. Okay. Oh, my gosh, what's going to happen now? You know, Dr. Parker, this was just, I'm so proud of you, man, because I'm just, I just witnessed this breakthrough happen. And it was,
watching.
Me too.
we literally witnessed this breakthrough here that was just so good for you, man. And Candy, what a difference you've made in his
Thank
life
you.
now, you know?
you.
And it's just awesome.
I'm very grateful. Thank you for letting me hear that. Thank you for making that possible.
Absolutely. Wow. Okay, we all,
Okay.
you know what, everybody, we need to take a commercial break. I need a commercial break. My face is frozen. You know, my face is half numb. I can half talk as it is. And when my emotions get all worked up, the spasticity in my face starts going and my face starts locking up. We're taking a break here and we'll be right back. Hey everybody, welcome back to the show. This is Life After Stroke. I'm Christopher Ewing, and wow is all I can say right now. I'm just like speechless. So I guess I have to ask you, so you pet the dog all on your own too. Mm-hmm. So what was it prior to you petting it? What were the emotions?
I didn't quite know whether I could touch the dog or not.
You didn't know if you could touch it because of the fear of touching it?
Because of the part fear. I don't know what else.
Huh.
Yes, part fear.
Yeah. But you didn't think it was going to bite you.
No.
And you weren't afraid of it germ-wise.
No.
But when she first came in here, you were ready to like jump through the ceiling.
I guess.
And everybody's nodding their head, and you're like, yeah. Everybody is like,
okay.
like, yep, that's pretty much what
was ready to jump through the ceiling.
Yeah, you were pretty mad and pretty upset that she came that close to you with the dog. Yeah. And the dog was just in a cart. Like, you know, everybody listening, you know, she didn't have it on a leash. It was, how would you describe it? Like a shopping cart with like, but not deep. It's like a, Yeah, like one of those little shopping carts, but it wasn't deep. It was like a tray cart type of thing. So the dog was just kind of sitting on top of it. And I mean, the dog is just like a little mush dog, so it's not like it's one of those ferocious looking ones, like you just want to mush it in your face and just kind of play with it.
Cocker Spaniel.
Oh, so it was that kind of dog. Yeah. So it looked. So I guess my point is it looked familiar to you?
Then 10 years, starting when I was 4 or 5. And till 14 or 15.
It's so amazing too. We've had physical therapists in here, we've had speech therapists, we've had OTs in here, and they've worked with the survivors during the group and stuff like that. I never would have thought that an animal therapy situation would. I tell you, we're covering all the bases in here. I mean, But you know what? Again, that's what the group is about.
And next week a lion.
And next week a lion. Yeah, right. You might have. You guys might be on your own in that one. I don't know if I'll be here for that, but no. But boy, what a really, really cool breakthrough happened here, Doctor. And I'm so, like I said, I'm just really proud of you that you just kind of said, "Hey, I'm just gonna." Because you even reached and pet him on your own. It wasn't like anybody had to kind of coax you into it. All of a sudden, we just saw you reach over and just pet him.
I pet my 2 dogs occasionally. But
so do you have dogs at home? You don't have dogs at home.
Very frequently. And then I get up and go to the other room.
Yeah, because now you live with your daughter on her property.
I am in a custody near my daughter's house.
Yes, right. Now, does she have dogs?
Yes.
So you pet her dogs periodically.
She has 2 dogs. One a Maltese and the other a Pomeranian.
Okay.
Mutt. Pomeranian mutt.
So right before you pet this dog here just now, what was it that was in your mind? Because like I said, you just reached over and just started petting it, and we were kind of, he's reaching over. What's happening here now? I mean, we knew you weren't going to hit it or something, but you just all of a sudden just went right for it, just petted it. What was it in your mind? Did you tell yourself, I'm just going to do this, or what?
Yes, I am going to do this, and I have to put my hand on the coat.
Bravo to you, Professor. I'm telling you that. Wow, you pushed through and broke through, man.
Oh, yeah.
Dave, that's just like the kick in the tail that you say. Just do it. You just do it. Whether it's trying to get your hand to move, your arm to move, you just
got to do it.
You just got to do it. Yeah. And bravo to you, Professor, for that breakthrough. I mean, that was a major breakthrough. I mean, you weren't having any part of that. So now let me ask you this. Having done that now, does that make you feel any more comfortable going forward? Like if you were to see another dog that you knew was going to be fine, does it think of it like, or going to your sister, your daughter's dogs, do you think you'll go to them now a little differently, like a little more at ease than you would have before?
Because there's the younger one is all over the house. She makes it between my teeth. Toes.
So she's all over anyway. So you're okay with her, or not so much?
Not really. I like her to stay a little, not a lot, but a little away.
Do you think that's something that you'd want to work through, or are you just fine with just not being around any dogs?
I don't know. Perhaps if you bring Candy back in with the dog, I might make it close to me.
Yeah, but I guess what I'm saying is you do this for you. You know what I mean? You don't ever have to touch a dog as far as I'm concerned. I mean, that's entirely up to you. But I think everybody in here I think we all felt the same thing. We just really wanted you to break through that, especially given the fact that you had said that you had always liked dogs before your stroke.
Oh, yes.
So we just really wanted you to get back. It's almost like we wanted you to walk again, or to, you know.
We had 4 dogs and 3 cats.
And like you said, just before the stroke, you were fine. After the stroke, no part of it. And so that's why I say this is a big breakthrough, and I'm proud of you, and I'm glad. And, you know, next week when she comes, if you want to try to bring the dog closer, again, for you, not for me and not for anybody else in here, but just for you, that's great. She'll be here. If not, hey, you did what I certainly didn't think you were going to do today, given how adamant you were about not even having her in the room. So this was a breakthrough, and you know, and it answered a lot of things for us in the respect that here's yet another type of therapy, another type of therapist, if you will, doing what they do. You know, helping us walk, helping us talk, helping us eat, helping us move our arms, and helping us break through fears that we really didn't even know that you'd have. I mean,
and getting back out there, and just getting back out there.
Yes, absolutely.
Dealing with the stuff that you would deal with before, and it wasn't even an issue.
Right
now, it is.
Right. Yes. And it's interesting too. I had asked her, you know, what kind of breakthroughs she has seen, and shoot, we just saw another one right here. You know, I mean, that was really awesome. And I know we've talked a lot about this, but it was, you know, for everybody listening, this was a major moment here that, you know, if you could have seen it, it was really heavy. So, you know, with the few minutes that we have left, we'll spend a few extra minutes here. I want to talk about your books. Because, and that's what we were going to do today anyway. So now we're finally getting to it, but this was all worth it. Dr. Parker is, as you may have remembered from other episodes, and we've talked before, he has his PhD in education. He was a educator at the University of Chicago and Rutgers and all kinds of places. So in 2009, you had 2 strokes in one day, and it basically knocked out your ability to speak. And I'm not even going to ask the ridiculous question of, oh, how did that make you feel as an educator who, you know, was an educator in linguistics and teaching language to teachers and things like that? You know, how devastating was it not to be able to speak? I mean, that's ridiculous. I can't even imagine. I just can't even imagine. And then this journey.
I was depressed as hell.
And, you know, and knowing you as I do, and as I've come to know you over the past several months, you are just amazing. I mean, you've written several books, and one of the books that you wrote specifically about your stroke, your 2 strokes, appropriately titled, I'm on my way to healing, 2 strokes and a recovery. You really tell the whole story. I mean, just an amazing story. And your wife played a very important role.
Oh, yes. Most important role.
So it's really an amazing book. You tell the whole story of, you know, we were at the coffee shop and you had your first stroke in the parking lot. Now, in the book, one of the things that you talk about is the fact that you finally got to go home, but then you had to go back again. What's that about? Why did you have to go back?
Because I pass out in the morning under my wife.
Oh, that's right. And you were on top of her, and luckily she had her phone and could call. You guys really have to get the book. It's really amazing. But you had been in the hospital for so many days, and you finally get out.
I been in the hospital for 43 days.
Right.
Came home for one day and went back in the hospital for another 5 days.
And I bet you were so glad to get home, and then doggone it, you wound up right back there again. And then also there was something about a feeding tube that was, how did that have to come into play?
I had a feeding tube for about 6 weeks. When in the bowl and came down to my stomach.
And so
They didn't know whether I could swallow.
I see. So that's why they did the feeding tube. And so, and then the food had to be prepared almost like what? Like a mush or something?
Like a mush.
Oh my goodness. Well, it's a really thorough book, and it really tells the story of what you've had to go through. And really, your recovery since then is even amazing because your speech obviously was affected, but it was very affected by the time you had written this book. At the time you had written this book, you're improved since then, huh?
Oh, yes. Much improved.
Right. Well, the name of the book is I'm on My Way to Healing, 2 Strokes and a Recovery. It's available on Amazon, and definitely you guys grab it because it's just such an interesting read. It's really amazing to hear people's stories of recovery and how they're able to kind of pull it all back together and pull themselves back from the brink of, what the heck just happened to me, and to hear the steps that they've taken to recover. And to look back and think, wow, that happened. I mean, I see you now, and you've written books. You're still writing more books. You've got 2 more books that are coming out, and it's still like, my goodness, it just really. And I think you said this the other day, Dave. It really speaks to the power and the will that we have. The will to recover and the strength that we can conjure up and pull together.
Or your character.
Yes.
You actually, you're based on your character. It's basically, this is what you are.
Yes, absolutely.
But it's actually that comes out.
Right.
You see it many times in your life, but not so much as to when you really need it. And then all of a sudden, it just rises to the top.
Absolutely. So true. And it's funny, we even saw that today, to go back to the dog thing, I mean, it's just
basically, you did it. You just,
you
hung in there.
Oh, yeah.
All about breakthroughs.
I had to hang in there.
Yeah, he toughed it out. Absolutely.
You stood right there and just stayed there.
Yes. And isn't that interesting? That's really what a lot of this is about throughout this whole stroke experience.
But it's doing those steps every single day.
Yes.
It's every single day you've got that thing that you're chasing, those little demons, and you know what? You go after them and chase them down.
You're right, Dave. Absolutely, and that's really what this whole recovery is all about.
I'm still chasing those demons.
Yes.
Yeah. Well,
as are the rest of us. Yeah.
Yeah, sure. Because the demons can come in any kind of form. You'll never make it. Don't try it. Don't do it. Oh, you've lost it and everything else.
Or you can't do that anymore.
Yes, correct.
It's like, watch.
Yeah, right.
Yeah, that's right.
Absolutely.
Watch.
Absolutely. And that's you, Dave, big time. You are all about that.
Just that, that tenacity, just, not to stop. Maintain that tenacity.
Yes.
And get the word out.
Yeah. And
there's a lot of people out there that are in the same boat we are.
Yes. Yeah.
And some have tenacity and some don't.
Yeah.
Right.
Kind of like 3 frogs on a lily pad.
Yeah, there you go. Yeah, absolutely. Well, everybody listening, this has been kind of an interesting day, and this is just kind of our time to kind of get together and talk and really share our experiences with all of you that are listening in, hopes that, maybe you can get some inspiration from some of the things that other stroke survivors have gone through. Because, when you go to a stroke support group, and this has certainly been my experience as to why I wanted to do something like this, I was new to the stroke game. I had no idea what the heck stroke was. And just through going to the support groups and meeting people and hearing their experiences and things that they did to try to help themselves recover and rehabilitate, it's like, wow, okay. So, we kind of learn from each other through all of this. And, so that's why, today's show is kind of what it is, because it just kind of becomes what it becomes, and I just...
That's right.
Yeah, and that's why I said, what, we're just going to make a stroke support group and put it on the radio, and whatever happens. And, right. People who don't have access to a support group, this can kind of become their source of inspiration and things like that. And I know, Dave, and I'm one of them, through listening to you on the show every week. I'm telling you, you have kicked me, like I said on last week's show, you kicked me in the tail cocktail more times than you even know, and I'm sure there's other listeners too that have, really gotten some inspiration from you.
Something that we all need, but, and being in the same position, it's just like, you got to do it.
Sure. And, and I guess my point in this is that some people may not have a Dave or a Dr. Parker or a Christopher or something who's kind of over their shoulder saying, come on, you can do this, So that's the kind of reason for a show like this, is to kind of be there as a support for others who don't have friends or other stroke survivors.
Absolutely. And it's just like all three of us have something very much in common, but it's just... Yeah, but it's sad that it's a stroke.
Yeah.
And it's just enough to, but to push us.
Well, you guys are awesome, and everybody listening, just know that we're here for you. We love you guys, and we basically, do this every week for all of you who are listening, I thank you guys for being a part of the show, and, drop us an email, let us know, if you have any questions, and also let us know where you guys are at in your midst of recovery too. I'm really big on milestones, so hopefully you guys are doing your milestone journal and stuff like that. Email us and let us know how some of the milestones are happening in your life. I'd love to hear from you guys. So anyway, that's the show for today. Until next time, remember, there is still a beautiful life after stroke. This has been a recorded program of an actual stroke support group. The comments expressed are the opinions of the participants and not necessarily the opinions of the producers, sponsors, or the broadcasters of this show. This program is not to be used as a way to diagnose or treat any medical condition that you may have. Please consult your doctor or healthcare professional before making any changes to your current medical routine.